You're watching Byline Wilmington on CBS 10 WILM. Here's your host, Don Ansell.
We're back with Dr. Paul Kamitska, who is an infectious disease specialist here in Wilmington with Wilmington Health Associates, talking about the H1N1 virus. We call it swine flu. I know there's been a vaccination or a vaccine developed, but before we get into that, have there been some fatalities in our area?
Yes,
there has.
Last week, there was a child who died of H1N1 influenza here in North Carolina. And in a subset of patients, it can cause severe disease. Over the past 15 years that I've been here, for example, from seasonal flu, I've seen 0 patients who were sick enough to be on a breathing machine in the ICU due to seasonal flu. Whereas over the past 2 months...
In 15 years, you've seen zero numbers that got sick enough they had to go on a ventilator.
On a ventilator from seasonal flu. But in the past 2 months, we have 5 and possibly 6 who've been under the age of 40 who've been on breathing machines in the ICU. And so this, in the subset of people with this virus, it can be very severe. You know, and we don't know exactly how severe it's going to ultimately land out to be. So far, fortunately, most cases have been in the same range of severity as seasonal flu, but with the exception that it is targeting the younger population.
All right, so let's talk about this vaccine. Where was it developed?
There are actually several companies that have this vaccine.
These are pharmaceutical companies, companies?
There are 5 pharmaceutical companies that are doing it, both here as well as elsewhere. And in fact, the first vaccines were just released yesterday to the distributor, and it's going to be another 2 or 3 weeks before we'll have access to the vaccine, because it's going to be distributed through the public health network in the United States. Right.
How long does it take once you get, I guess it's delivered through a shot or a nasal spray?
Right, there'll be mostly shots.
Okay.
And then a little bit of nasal spray for particularly the pediatric population.
And how long after you get the shot are you immune?
It takes about 2 weeks.
Oh, it does?
Yeah, 2 weeks.
So you could pick up swine flu after the shot?
Absolutely,
You could.
yeah. But after about 2 weeks, then you should have immunity.
There seems to be a lot of angst, or there has been, around whether someone should get the shot,
right,
or the inhaler. Is it safe? That's what everybody wants. You know,
right,
that's
right.
the concerns.
Okay, and based on what we've seen so far with this H1N1 pandemic, I would say it's especially for those who have risk factors for severe flu illness, and we're talking about people who are pregnant, young children, anybody who's got other diseases like heart or lung disease or immune suppression. It's far, far more dangerous not to get the vaccine.
What would the danger be?
Well, you know, I think a lot of the concern stems from 1976, when there was an outbreak of swine flu in Fort Dix, New Jersey. And the government responded by vaccinating people for the swine flu. There were 42 million doses given. And the problem there was an increase in the incidence of a neurologic disease called Guillain-Barré syndrome. But when you look back...
Was it a faulty vaccine?
We'd have to say it is, in the sense that since 1976, we've really not seen a problem with Guillain-Barré at all. So we've gone all these years. But if you look at the numbers, there was an extra 1 in 100,000 cases of Guillain-Barré among vaccine recipients, and there were 32 deaths. But that risk has to be sort of balanced against the risk of the swine flu. And there was a study last year that suggested that you're 4 to 7 times more likely to get Guillain-Barré from the flu than the flu shot.
Okay.
Yeah.
Can you get flu from the shot?
No.
No.
No,
And
that is, no.
Without, you just can't.
No,
but you can get symptoms?
Well, no, from the flu shot, you cannot, because the flu shot is basically killed proteins, basically. From the live spray, you could potentially get mild symptoms of the flu, because that's a live vaccine. But from the flu shot, which is killed, you cannot.
And then there are people say, well, I got the flu after I got the shot, but It takes 2 weeks for some.
Well, the other thing is, for people who say that I got sick after getting the flu shot, the overwhelming likelihood is that they were already incubating another virus, a cold virus, for example. And that's what they got sick from. It had nothing to do with the flu shot itself. So,
You know, we're seeing ads, I saw ads on television, on Walgreens, CVS, saying flu shots available here. These are not the swine flu shots.
No, those are seasonal flu shots.
Right.
That's the every year flu shots. The H1N1 flu shots have not yet been released.
We don't have them yet.
We don't have
Would you
them
say
yet.
about 2 weeks?
2 or 3 weeks, hopefully we'll have them.
And who should get it? Who shouldn't get the shot?
And the highest priority targets for getting vaccination are pregnant women, young children under 5, and children who have underlying medical conditions like asthma or heart disease or immune problems, and also healthcare workers. Those are the primary initial targets.
There's been discussion about maybe needing more than one dose to be effective. Is that
And for
true?
Kids who are 9 and under, they will need 2 shots, 3 to 4 weeks apart. But those who are older, 1 shot, it appears, will suffice.
We have like 1 minute.
Okay.
And since you're here and you're an infectious disease specialist, what's the status of HIV in this area? And we just had a report of a vaccine that was tested in, I think, Thailand.
Right.
Can you give us a brief outline on that?
Well, it appeared to be protective in about 1/3 of vaccine recipients, which is great news. It's really great news. I think, though, it's preliminary in the sense that just like with the flu virus, the HIV virus is a wily target. It keeps changing, so it's very difficult to get a solid
Are we
target.
still seeing an increase in cases here?
We see
New cases
of HIV, oftentimes in women from sexual contact with men. So it's, yes, we still see
Still a
yes.
high risk and a high danger.
Yeah.
We're out of time. Thank you so much for joining us.
It's a pleasure.
Stay with us. Actually, next week we're going to start our series of interviews on the Wilmington City elections. Our guest next week will be Paul Knight, challenger for the seat of mayor of Wilmington. And if you'd like to watch Byline online, you can go to WILM-TV.com, WILM-TV.com. I'm Don Ansel for Byline Wilmington. We'll see you next week.
You've been watching Byline Wilmington on CBS 10 WILM. Join us every Sunday morning at 11 as we explore the issues that concern you.